I'm Markus Kuiper, and I welcome you as your moderator to this DTEC Mythbuster webinar on Health Wallet for COVID-19, a timely topic to discuss in the week of December 2020, and what a year it has been, in a year which can only be described as a game changer for data analytics in life, in business, and for health. I'm the Chief Marketing and Growth Officer of DTEC and the former head of Product Portfolio and Marketing of Airbus Cybersecurity. I had the privilege to work in many industries like marine, automotive, aerospace, defense and industrial, and hence I have witnessed numerous digital transformations of companies and governments alike across the globe. I'm delighted to bring this Data Analytics Mythbuster series to you today, as it is truly driven by real and eminent challenges and issues in data analytics, hopefully relevant for all of you. It's a great pleasure to have you joining us today in our global gathering, virtual gathering of great minds discussing a truly burning platform. So how will it work? I will introduce the panelists in a moment, and then we will go straight into Q&A. We don't have presentations for you. I will have one or two, three questions to start with, but you can start using the chat function immediately, and we will ask your questions, or you can even unmute yourself. Please feel free to use the video and ask your question yourself. So let's get started. Joining us today are two veterans and pioneers at the same time. Sander Swinkels and Julian Ranger. Both are privacy and security industry experts and have been having exposure to initiatives across the digitalization of national security, healthcare, government, and the private sector, from Australia to Europe and to the USA. Sander Swinkels, here in a black suit today, joining us from the Netherlands, is the CEO of DTEC, a Dutch-Singaporean data science and analytics company, whose mission is to deliver intelligence from data with purpose and impact. He brings years of experience in national and public security projects. Sander is a serial cultivator, business architect, and innovator, with over 20 years of executive experience. Some of his past endeavors include experience with the Royal Netherlands Marechaussee, which is the Dutch military police, Capgemini, Palantir, Singapore FinTech Consortium, Secus Ventures, and DutchSec BV. He is a sought-after mentor and advisor and consultant to both industry and government entities. Welcome, Sander.
Great to be here. Thanks, Markus.
Julian Ranger is the executive chairman and founder of DigiMe, which enables the Internet of Me by putting individuals at the center of their digital life, owning and controlling their own data. Initially an aeronautical engineer, he specialized in 1987 with subsidiaries. He specialized in interoperability and military internet, founding Stasis in 1987, with subsidiaries in the USA, in Germany, Malaysia, and in Australia, before selling it to Lockheed Martin in 25. An angel investor in more than 20 startup businesses, including Halo, DataSift, and Astrobotic, Julian is also, and I find this intriguing, a Virgin Galactic future astronaut. Good morning, Julian.
Good morning, everyone. Good morning.
So let's get started. I will set the scene for us, and then it goes straight to you, Sander and Julian. So, ladies and gentlemen, from around the world and from many, many industries, today's webinar is going to cover a few things. Digital health wallets, what they are and what the future will bring, social mobility for work and leisure, and what other solutions are available to us to help keep our businesses, travel, and events continuing during this unprecedented global pandemic. We've all been watching and listening to the COVID-19 vaccine news updates recently. One that actually works might be available for the masses soon, but that won't bring an immediate end to our global health crisis. So what is a health wallet? Very simple. Health wallets are combining the best digital technologies to help employees, travelers, and family members to seek the health support they need more efficiently and effectively at their fingertips. It also helps health administrators and insurance companies to provide more value to their customers and around the globe. The question we will discuss today is, can a health wallet become key by overcoming the COVID-19 pandemic? How can it help businesses to continue operations at numerous locations and still stay safe? And how can it ensure immediate response for health authorities, employers, and policymakers alike? How can a health wallet and its future design upgrades bring back travelers to airports, to cities, and to stadiums for that matter? And what about privacy? How can we ensure our personal data is protected at all times? With this, let's get started. Julian, I would like to start with you. Why health wallets? What are they adding to our life, and how do you see their function and their meaning today?
So, good morning, everybody. Essentially, a health wallet is a mobile application stored on your handheld device. The key behind them is that the individual is the only person who can bring all the data about themselves together in a single place for rapid reuse. So it's all about data flowing to the individual, being used by the individual, and then being shared by the individual outwards. Now, the great news is that if we bring in all the data back to the individual, we solve privacy, security, and consent issues at the same time, because the individual's at the center of that. But also, we greatly simplify access to and sharing of that health and indeed other data, as we'll see as we go through this webinar today. And that's really, really important in crisis situations where speed and simplicity is of the essence.
Sander, thank you, Julian. Sander, how do you see health wallets from a digital point of view? I mentioned in our introduction, it's basically bringing the best of digital technologies together. How does data analytics fit into this picture nowadays?
That's a good question. And we have to ask ourselves the question, what's the value of data analytics? I think most attendees today understand what analytics does. But if you look at the pandemic example, for example, it's not simple. There's so much data that could be collected, are collected, but what's the actual correlation between those? Simply, if you look in an airplane and if you sit on a certain seat and somebody was infected near to you, like what is the actual chance and how do you correlate it with the chances that you actually could be infected? We collect data when you enter certain buildings in certain countries right now. How do you correlate all these things and do it in a speedy and a scalable manner?
Right. So we basically see that health wallets are very important as a measure going forward in bringing back business to continuity and mobility. So, Julian, let's look at the challenge of transnational mobility. What approaches can we take for air travel in your view, for example?
Well, let's just reprise the data that could be in a health wallet. So as I mentioned, it's about me, the individual, getting my data back and even creating data locally and then being able to share it. So in a COVID situation, that means, firstly, I'll have my health data from the health system. I can enter my self-assessments. Now that in itself is useful for businesses to know how their employees are, etc. But from my medical data, I can also receive my test results and in time my vaccination results, so that I have with me all the time a full record of my health and, in the COVID crisis, my testing status and my vaccination status. So as I travel, I can now show that test and vaccination status clearly. And in fact, that can be validated very simply off the handset in a number of different ways. So the key here is that it opens up a whole load of use cases, whether that's helping businesses with their continuity, helping travel, we're going through, and we'll see that there's also the ability to include a fully private track and trace capability. So from my medical data, my self-assessments, my test data, my vaccination status, and also where I've been, then all the information is now available in a single place from the individual to support businesses and to support travel.
Is this really reality today already, Julian, or is it fiction? And how many companies are actually embracing this with a solution for COVID-19?
Yeah, no, it's absolutely not fiction. So our company, DigiMe, has been around for quite a while. We've had a fully developed solution in what's called more generically as a My Data world, and we're what's called a data facilitator. We provide that wallet, which is not only a health wallet, but actually includes finance data and social and a much wider view of the individual. And that's in use already, and we have multinational tier one companies and indeed governments, because of course to get access to health data you have to have government funds. So this is very much an existing technology. What we've done in partnership with your good self, Sander, and the team has created a specific capability focused on the needs of businesses and for travel called Consentry, and that is real and in use today.
Excellent, thank you, Julian. And Sander, what use cases could you share with us where data analytics is really getting used in a way Julian is describing already?
So let me start with an example. The pandemic was a big surprise for many societies and many governments. And initiatives have been started to collect data. In some countries more privacy-centered than in other countries. But if you look at the pandemic challenges, one is like who is actually at risk, who's infected, who's going to work, who's not. And what you see like in Singapore, where we were the first initiative to get a hand on collecting the data was asking employees to register when they go to an office and when they check out. And this is a great initiative, and it does support potential contact tracing. So if somebody is infected, to get back to what is the potential location where somebody got infected. The problem though is that it are all decentralized databases, unless you put it all into one single database. The second thing is contact tracing isn't as simple as a binary yes or no if somebody has a risk. Because there's a lot of outside factors like what's the proximity, how long has somebody been with, is there ventilation in the room, etc., etc. So if you look at analytics, that could potentially help to put a hypothesis on is there a match, yes or no, and should we think of improving that and along the way. Looking at the use cases for the economy, for tourism, for travel, for everybody's, like a lot of people are getting tired of being in a lockdown. So what we try to do is enable some freedom by showing like I am at low risk or no risk for the people who are not sick, while protecting the ones that are at risk.
Excellent, thank you. So let's become a bit more specific. Julian, how could a solution like a health wallet, and obviously you're representing Consentry, and feel free to explain that a little bit to the audience, how could that help for employees and employers to bring their people back to work in a safe manner?
Yeah, okay. And not only in a safe manner, but also in a confident manner, and in a way in which keeps business continuity. So employees have to have the confidence to come back to work. So knowing that you're taking actions to keep them safe, but you need confidence as a business as well to be able to keep going as a business. So there's two key elements to Concentrix and then a third, as always. So the first is individuals are able to create a self-assessment each day and share that with the company anonymously, but it allows the company to see the health status in real time with their employees and very quickly to see if there are hotspots developing way before you would do from any tests or other indication. So the first piece is individuals, employees sharing their self-assessment with the business. The second is then you have to manage if somebody is in your buildings that subsequently has had COVID. So you need to have a track and trace system. It needs to be zonal because you don't want to have to put the whole building into quarantine if one person was there. So you want to separate positions, and it has to be private. So we have a system with Concentrix where the individual scans QR codes. That location diary is only on their device, and it matches and gives the individual alerts when there's somebody who's been in the building with COVID. And then the final element is the ability to be able to see and have from the employees, and the employees have for themselves, their test status when they've done COVID testing of any type. And as we move forwards now, and you'll have probably heard the news in the UK this morning, that the Pfizer vaccine has been approved for use, and that will start next week, is also your vaccination status. So you have from the employees their self-assessment, the location, private location diary, and their test and vaccination results, which can also be used much wider in your business for travel, etc.
Thank you, Julian. So what we're hearing is that an app used for businesses can identify hotspots, for example, even in a meeting room or in a factory or with a customer meeting. But Sander, question to you from a data analytics point of view. This requires employees to agree to share their data, right? So what are your experiences around the world from Australia, Singapore to Europe, and what do you see as maybe stumbling stones and as solutions for this?
The most important thing is that the citizen or employees is actually in control. So whatever I'm going to tell now, the most important topic is that everybody's in control. Do I want to share my data, donate my data, and in what sense? Anonymously, or even the whole file if you go to visit the GP. So that's step one. Put the citizen or employee in control. And it's up to the science community, the employers, to convince people why they should share data and for what purpose. So Julian mentioned the vaccines coming in, and the good thing is that this framework of the data points collecting in your personal store is that it started with your location details and your self-assessments and the tests when they got available, the vaccine in a later stage. There's a lot of concerns about the vaccine. There's a lot of people in the population who not completely trusting it yet.
Sure.
And if, for example, the science community would say like, hey, if you donate your data, so you keep doing self-assessment data and you register that you're actually safe and healthy, in combination with the fact that you already had a vaccine, it could help society to get more trust in what it actually does. So from an analytics perspective, it's looking at what's the next factor that we should count in and have a convincing story by either the government, the employer, on why people should donate. And then we will see what the response of the individual will be, who is in control.
Yes, I was going to say on that aspect of the vaccines, one of the really key things as we move forwards is what is the efficacy of the different vaccines in the real world? We know from trials to real world. And in fact, the data analytics for that is going to need to know in mass numbers, what vaccines have you had in the lot numbers, etc. Have you caught COVID? How are you feeling? And your medical records. And in fact, there is no nation state that is set up to currently pull that data together quickly and make it available for that analysis, if you like, of the effectivity of the vaccines. However, through the individual, it can be done very quickly and effectively because the individual has a record of their vaccines and their tests their self-assessment and their medical records, and therefore can donate from a single point. So we're seeing again the fact that whatever you need to do, the individual's consent, the individual as the point of integration, makes it much faster and quicker for that data then to be available to businesses for travel, or indeed in this vaccine effectivity, and then the data analysis can be done on top. Just a key point.
Excellent. Sander and Julian, we do have a question. I'm curious how dependent solutions are to having scale, i.e. what's the tipping point of use in an organization, a community or country for this to be fully effective? What percentage of any system or part of one needs to be using the wallet, for example, to make it really workable? Any thoughts on this?
Well, the good news there is, from a business perspective, you only need your business to be effective for your own continuity. So your employees, your buildings will suffice. Now, of course, if you can then spread the use through the community, then you increase the effectivity. If there's a possibility of catching it in the coffee shop nearby, etc. When it comes, however, to the global issues of the vaccine effectivity, then that will generally be more of a national program, have to be done because of the diversity. But from a business, you can do it as a single business in a single site. So we have businesses of small numbers, some tens, up to hundreds and thousands of employees, and it works self-contained at universities as well. But some aspects and the data donor then will be national. Now, clearly, if you could make the data donor multinational as well, that would be even better. But that's the subject of international coordination, which I think is unfortunately beyond our remit today.
Yeah, I think we will have a question for this later on, Julian. Sander, any thoughts on coverage?
Absolutely. And thanks, Julian, for explaining that. Let me look at the beginning of the pandemic, and there was a lot of focus on, for example, a track and tracing app, like purely on who has been where and in the proximity of whom. That came with a lot of discussions about privacy, which is solved by this private wallet and health wallet initiative. But the problem with the proximity apps is that was really dependent on how many people are actually using it. What we try to say here is that the data that you collect in your digital health wallet, it's more than just your locations. It's your self-assessment. It's if you're tested, yes or no. And being able to correlate all these different data points beyond just locations where you've been makes it actually easier to make predictions and to put in risk factors to alert people like you might be at risk, or to inform employers these are specific locations where you should look at more carefully, or change the process in how you board people in an airplane. So the fact that you combine more data points than just the proximity makes it less dependent on that everyone should use it at this point.
Based on that, and Julian, we were hinting to this, organizations can be cross-national. You are talking to some multinationals, and if they have 50,000, 100,000 people participating in their health wallet, they don't depend on a national or government solution anymore. How do you see, who should actually trigger the solutions? Should it be more the companies, or should we be waiting for governments to serve us all?
The difficulty with the government is they have to deal with the macro, and the macro is the tens of millions in their country, and not the micro. Even the biggest business with 100,000 employees is the micro in their team. So you will always expect anything that the government is doing with its app, with its processes, is aimed at giving information to the government, not the business. So as a business, you need to have your own resource to be able to do that. Now, as it happens, a lot of the government applications have been based upon the Bluetooth and haven't necessarily been as effective as they would have hoped to be. But fundamentally, you need as a business to have your own resource. And of course, if you as a business are multinational, then you want something that will work in any nation. The beauty of having the data originate from your employees is that it does work in any location in the world. There is no national specifics. Now, as we move into the test results and the vaccinations, then those have to be brought into the health wallet, and that's work that we do from there. But essentially, yes, it's business-led because it's the business that needs the information and to manage their employees and of their facility.
Thank you, Julian. Sander, any thoughts? Who should lead the efforts? You have a lot of experience in that.
Yeah, it's in many cases it's catch-22. Businesses are waiting for the government on the businesses or other governments or international standards. If you look at the world of counterterrorism or cybersecurity, it's a similar problem that it's not bounded by a certain country. It comes with threats and risk from everywhere in the world, and you have to find collaboration and especially interoperability. So what we're not saying today is like you should work just what we have, but we should ensure that there's an interoperable system that allows the economy and society to move forward. Meaning that, yes, there are discussions, for example, in the airline world, in the IATA, like what should be the default health pass if you travel? What should be the default test to actually create that health pass? And in this waiting vacuum, it doesn't mean that we should stop and wait until a decision is made. It should come with trying to convince both businesses as governments on a centralized or a decentralized level to just get started and allow that it's interoperable, that if another decision is made or another initiative is there, that it actually can talk to each other and that you can simply add new components to it.
Excellent. On this topic, yeah, Julian, please.
Marcus, I think it's actually a key point again that to bring in the simplicity when the individual is the integration. So we've had a lot of experience of this at DigiMe, bringing in, for example, interoperability of health data from the US, from Holland, UK, Iceland, amongst others. And it's always when you have these one-to-one links through to the individual rather than the many-to-many, you totally simplify that capability. So it's much easier to create a commonality internationally when that data is flowing to the single integration point of the individual. And that's something that is, again, worth noting. It's all about the simplicity of the overall integration.
So we're talking about key success factors for data analytics and a health wallet seem to be simplicity and interoperability, right? So from experience, we see that it varies from country to country whether the individual owns the data or the country owns the data, correct? So how do you go about this? There are some countries where the individual doesn't own the data, it's in one national database. How would you deal with that for a traveler, for example, compared to someone who 100% owns his personal data on his or her mobile phone? How do we deal with this? How can that interoperate?
Well, actually, it's not quite as clear, straightforward as you're saying that. Actually, all around the world, some governments will own the data, but nearly always the individual has a right for a copy of the data. And of course, as we say in the terms, data is non-rivalrous. You can have multiple copies. So the government still has its copy, but the individual has their copy. So we're not actually in a bad situation in that case. The individual can always have a copy. The real question is, have governments enabled, if they're managing the health system, have they enabled the interfaces to allow the individual to get their information back using products? And that's more the limiting factor. Now, it's not a complicated thing to do because most systems have APIs today and can be very rapidly integrated with. But it's the access rather than the rights, which is the main issue. So some countries don't have yet the access point, but most have the ability to turn that on very, very quickly.
Excellent. Sander, any thoughts?
Yeah, one remark in the discussion, like does the individual have the data or the government? I haven't seen one, not real example where a government has a data warehouse with all the data collected in one data warehouse on every single life factor or health factor from the individual. They still have silos with different type of data. What it brings as a challenge is what's the simplicity to actually say something is safe or not safe when people, for example, start to travel again.
Mm-hmm.
So the discussion is more like, even that there might be more data available in the health wallet or in the centralized system, is to bring it back to almost a green or red code or an orange code. Like, should somebody be allowed, or is it safe to actually travel, go to work, etc., etc.? So in the interoperability and sharing discussion, what should be known is that at least when somebody wants to board the plane, and that has nothing to do with if the government stores the data, is that the individual actually has to show something before they board the plane. And if you don't do it, that's fine. But it could mean that you might be rejected, or you have to follow a longer process to be able to travel if you don't want to volunteer to share those data. And one other thing is that with this health pass or test results that come back and end up in your wallet, there's a lot of ways to, for example, to encrypt that, and that there's simply a QR code that the lab doesn't even have to see who the individual is who does the test. And that once it goes back to your wallet, it decrypts it like, these are my personal data. So from a technology point of view, there are solutions to make it easy without sharing all your personal data.
Excellent, thank you, Sander. I have a question which is probably on top of all of our minds, whether you are in Singapore, in Australia, in the Netherlands, in the UK, in the US, anywhere, and that is privacy. We have different privacy acts around the world. Europe has GDPR, we got the PDPA in Singapore, in Australia it's the Privacy Act, and many more. Sander, maybe I start with you. How can any data analytics-based solution guarantee privacy? Is that possible, and when? And if so, how?
So it all comes down to the consent or the rules on which data are collected. Like that's the key question. Like, whatever data you want to process and look at and get insights from, it always comes down to the question, did you actually have the right to have those data? So that was one of the reasons why we partnered with DigiMe in this whole endeavor, because they solved it. They solved the fact, like, the citizen is in control. They decide if they want to share the data, yes or no. Where it comes from an analytics or technical perspective, that once a consent is given, there's much more than just giving a consent. It's like, for what purpose can it be used? How long can it be stored? What's the retention scheme of it? Those are things that we can solve. So once we know what's the actual consent and for what purpose, from an analytics perspective, we can support that whole flow and make sure it doesn't get stored longer than the consent is given for, or that it's only shared with and distributed with the partners who should have access to it. So that means that you actually put a code on top of the data that come in on all these certain things, and that's the way how we can guarantee it. And one remark I want to make, like, it's not just the privacy laws, there's also a lot of regulations around not just sharing personal data, but especially medical data. And that's another problem, because it's not just any company who can create the app, collect some data and have a consent and to share it. You also have to make sure that you complied with the medical data regulatory stuff. And one of the reasons why we also teamed with DigiMe is because they have the certifications in many countries, not just to share and process personal data if consent is given, but also have the certification to share medical data when consent is given. And we shouldn't forget about that. And one of the considerations for businesses and governments I would love to give is take that into account as well.
Excellent, Sander.
Julian,
how can Julian, how can DigiMe and Consentry guarantee privacy?
So actually, it's on the screen at the moment. We're called we call ourselves a data facilitator. So we don't actually either see, touch, or hold any data. We're a bit like an email program. Just we enable the individual to get their data and then to share it with consent. So that's the absolute key, because I probably know too much about privacy and medical laws around the world. You're wonk, I think, on these things. But for all of them, at the heart of it, it's who holds the data, how is consent given and then followed through. And if the individual holds their own data, encrypted in their own area, and we don't see, touch, and hold it, then you meet the laws worldwide. If the individual is the only person who has the data, then only with their consent can it leave them. And that then is the key then for following it on from there. And of course, what it does is much more than just privacy, much more than security, much more even safety of health data. It's about trust. People will do these activities, they will share their data if there's trust. And if they're in control, then there's trust. And that's probably the biggest thing we'll praise from everyone.
Marcus?
We have a question. Yes, go on, Sander.
Before I move into the question, like one thing I always love when people ask us, like, what are you guys doing and how does this actually work? Actually, it comes down to the simple thing of a notebook, like what we used to do with a little notebook with a pen. If you suffer from migraines, it's quite normal that you write in your notebook kind of diary, like on what day you had what severity of migraines. Or if you're budgeting on what you want to spend in a supermarket and put it in the notebook. And actually what Digime has done is create like a notebook in which you collect your own diary of the things that you experienced, you faced. And then you ask the question, like, if you go to the GP to talk about your migraines, he will ask you like, can you give me some history on what you suffered in the past month or a few weeks? And this is what the consent tree actually allows you to do, is that when the question is asked and somebody has a good reason to ask you that question, that you swipe and then you share the data. And there is trust that it's only shared for that particular purpose.
Excellent. Which leads us to another question from the audience. How can data wallets and increased privacy impact business continuity? Julian.
So I need effectively my staff to be available to work for me, and we're going to have to go back to the office for a level of activity, maybe not always full time anymore, but certainly, a fair amount of people in the offices or in factories or in other warehouses, etc. So I need, as I said earlier, to make sure that I've got employee confidence and that I am managing the potential spread of infections in my buildings. So for that, the fact that individuals are telling me their self-assessments each day enables me to monitor the health of my workforce in a private manner and detect infection spikes. And the fact that we have a location diary which can give alerts if anybody was potentially affected means, and into zones, means I can manage that very quickly. And then as we move forwards, of course, we can start to amend our procedures based upon testing and vaccinations for entry and being able to slightly relax, in some instances, some of the conditions as we have a higher number of people both tested and vaccinated, and we can monitor that through the workforce. So it's very much about making sure that my employees are confident that they can come to work, whatever that working environment is, from the factory, warehouse to office, that I can manage any potential outbreaks in my facilities, and that I can return to normal as we go forward.
Excellent. Sander, your thoughts, data analytics and business continuity. How can data analytics contribute to business continuity?
For an employer, let's take an average employer. As the situation is now, they mostly know only on the day when somebody calls in sick, for example, or calls in like, I've been tested positive or I'm in quarantine. So only at the day itself, the employer knows like, hey, my business might be affected because that person might have a critical role or that group might have a critical role in the process. So if you look at data analytics, simply asking employees anonymously every day to fill in like, I feel okay, or I do have some symptoms, but I'm not sick, for example, And doing this over time might be able to improve your risk management as an employer to actually figure out what's coming in my way. So rather than just waiting for the day or the morning itself when you get a phone call, you miss an employee, you can think of what's coming our way. Secondly, if, and again, anonymously, you know that there's something going on in a certain area or location of your business, you can think of what could be the mitigating factors or things I want to put in place to improve this. And having these insights might be able to think of your risk management and how to focus on continuity of your business.
And is it affordable? I'm not asking you for prices, but what if SMEs are listening to this, or not only multinationals or any organizations? Julian, how do you see that developing? Do you need to have a big budget for ensuring business continuity with a health wallet like Concentrix, or is it adjustable?
Let's assume that most offices provide coffee and tea for their employees. And you wouldn't consider that a big budget. It's less than a coffee or tea per month. So no,
is that right? So for one coffee or tea a day, I can actually ensure that.
Maybe a week's worth of internal coffee versus a Starbucks type price. But it's in that order. We're talking coffee prices. You absolutely don't need to spend a large amount of money to do that. Now, some solutions require you to fit sensors all around your buildings and do things like that. They're viciously expensive, and they make little sense because they're not private either. They cause problems for individuals. But the reality is, again, because it's so simple that it's part, it's a bit of building, but because it's from the individual and everything's centered around it, it makes the whole integration piece straightforward. And it doesn't even take a large amount of time either, which is the key. So it's neither expensive in money terms, nor is it expensive in time terms.
And you simply have to download it, right? That's all what you need to set it up.
To set it up, yes, as a business, there's a portal. You can do it on the web, set it up for your staff. You have to print off some QR codes and apply those. And each individual downloads an app, and then each day does their self-assessments and scanning. So again, it's not complicated. It's less than a minute a day for each employee. So these things don't take much time if done well. And as I say, they're inexpensive both in cost and in time.
And will have a pretty significant impact for your business if you do that. So we are reaching the end almost. So let's go back to maybe social and business mobility, international mobility. We have a couple of major sports events coming up next year. We have the Olympic Games in Japan. We have the Rugby World Cup in the UK. We have Euro 2020 football tournament in 12 countries in Europe next year. Sander, Julian, how do you see this happening? I find it very hard to imagine to play in front of a crowd as we are in the first week of December today. How do you see that evolving?
You want to start, Julian, or should I do?
Well, I mean, I'm actually slightly fascinated because I'm a rugby player myself, despite my advancing ages. And we've just been told in the UK that we're allowed to start playing rugby, but we're no longer allowed to have scrums or maul. So the games are changing now. One hopes that by next year that changes. So yes, any team sports, any sports stadiums, they're all dramatically affected. Undoubtedly, as we move into that, there's going to be a heavy focus on regular testing and vaccinations. So your health pass, I think, will become one of the most important things, and you will have to have it as an individual because it has to be there with you as you enter a sports stadium. And you'll either have to sit in a queue taking tests to come into the stadium, or you'll have it there. So we'll see a preponderance of health passes being done. Of course, not everyone is going to be vaccinated by the time of the next Olympics. So it's going to be interesting to see what rules are put in place. but with a combination of rapid testing and vaccinations and a health pass, I am hopeful that all of these events will go ahead. I'd like to attend some of them myself.
I can imagine. Sander, from a data analytics point of view, how do you see a rugby or a player or an athlete for the Olympic Games or a spectator for that reason to travel from A to B, and how a health wallet will actually help him to have an end-to-end journey which is seamless?
I think one thing we know for sure, if we keep doing what we're doing now, it will be hard to actually open it up and organize it. So for example, if I look in the Dutch government, there's not one system or one wallet that actually says that you're tested positive or negative, or if you have a vaccine, yes or no. And now if you travel, and I've talked to a lot of people who are traveling now, sometimes you have to bring a paper, the paper sometimes for this country in a different language. So it takes a lot of time to actually process, should I let somebody in or not, or on board or not? So there has to become a system where people can actually show that they have no risk or low risk. The alternative is what Julian mentioned, is that you get testing locations in front of event locations. And I saw the great news in Singapore that the government had the first event, but people actually had to queue up, do a test, be in quarantine before they move to the event, and all kind of tables were allocated where they had to stay. So yes, there will be some restrictions, but what we should think of that if we allow people to have a digital health wallet and they're able to share that the low risk or no risk, and for example, they did the test or had the vaccine the days before, they might not have to do a test. And yes, there might be faster tests that can be done in front of a queue before you go in somewhere, because there's a lot of development on that end as well. But the world as we knew it will not come back. And we should think of a system that actually shows individuals that are safe.
Thank you very much, Sander and Julian. We have reached the end of this 45-minute webinar on COVID-19 and risk mitigation and beyond. Any final conclusion, Julian and Sander? Julian.
Well, it's interesting. We've been working in the area of personal health wallets, personal data wallets for quite a while. And I think what I would conclude from 2020 is that the need for an individual to be the focal point for their data has only increased. And the need for simplicity in the overall architecture of kind of mobile has been proven. So it's interesting that this was accelerated, if you like, this move to the individual having their data and then being able to do things going forward.
Thank you, Julian. Sander?
No, I think it's an exciting journey, and I think the timing of the webinar is actually quite accurate in what is needed for society. Again, the remark I would like to make as a conclusion, we're not saying like you should only use our stuff, but something has to get in place, and let's create a society and community in which we ensure this open standard, interoperability, and make sure that economy and society is moving in the direction we all want it to go again.
Thank you so much, Julian and Sander. Thank you to participants in joining us today. Do check out our website, both the Consentry website as well as the DTECT website. Here are the links. Thank you very much. Look out for the next Data Analytics Mythbuster event from DTECT. Have a Merry Christmas and stay safe. Thank you. Bye-bye.
Thank you.
Thank you, Marcus. Thanks all.